Welcome to yet another edition of COVID-19. I'm Min Sanhee. Korea is bracing for a typhoon just as it is seeking to contain its latest outbreak. While daily cases remain in the 200s, authorities are warning of a possible rise in mortality as the number of patients in critical condition now stands at more than 100. Also, out of every 10 patients, at least 4 have been found to be asymptomatic in recent days. We start the program now with the latest numbers for the pandemic with our Kwon So-ah. So, just start us off with the situation here in Korea on this Wednesday.
Sure, Sunny. Following a gradual decline in cases in recent days, Korea has reported some 30 more infections compared to yesterday. But health authorities mentioned yesterday that the low number of tests conducted over the weekend still may affect the numbers until Tuesday.
Right, so which means no need to panic, but at the same time, this means no room for complacency as well, right?
Exactly, and what has actually become a growing concern is that the continuous rise in the number of patients in severe or critical condition. In fact, this Wednesday, the number of those patients stands at 124. That is a rise from the 104 we reported yesterday, and that is why the government announced today that it plans to expand the number of hospital beds by 110 this month and around 500 by the first half of next year. Currently, we have 511 of those. But really, let's do hope that we won't need all those hospital beds and keep the fatalities low. Currently, we have 326 fatalities with 2 more added in the past day. And we have 267 new cases, along with 107 more people in quarantine and 158 more people who have been discharged from treatment or hospitals. Now, let's move over to our graph here. Compared to last Wednesday, we do see a significant decline. Although we have a one-day uptick in cases compared to yesterday, we are seeing that in the past 4 days, the numbers were in the 200s. And now let's move over to our map. The metropolitan region again has the highest number of infections, standing at 196 in these 3 regions combined, which again means that the number is below 200 now for the 3rd straight day. But we also see double digits here in Daejeon and Gwangju, as well as over in Daegu. Meanwhile, the country reported 253 local infections this Wednesday, along with 14 imported cases. And with that, let's take a look at the international figures. The total stands at more than 25.9 million and 861,000 fatalities, with some 18.1 million recoveries. Let's move over to the hotspots around the world. The U.S. at 6.2 million, followed by Brazil at 3.9 million and 3.7 million in India. And all of these countries are seeing fatalities above 1,000 on a daily basis. And it looks like Russia over here, although it's not adding as much as daily cases as other countries, it now has surpassed the 1 million mark. And there are still resurgences in many European countries, such as Spain, which now has surpassed 470,000 cases. And another country that is seeing an uptick in cases, even after seemingly having curbed the spread earlier in the year, is Italy, which now has over 270,000 cases and has been seeing some 1,000 new daily cases in the recent days. And that's a place Sunny will now connect to, in fact, to Milan. And I will be back with more updates after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Right, well, staying on the international front, Italy's daily cases are rising to highs not witnessed since the lockdown there ended in May. But against this backdrop, the 77th Venice Film Festival kicked off today for a 10-day run. For more on the latest in Italy, I have Irene Dominioni, a journalist in Milan, live on the line. Welcome, Irene.
Thank you. Thank you for having me.
Irene, Italy, as I just mentioned, is hosting the first major in-person cinema showcase of the pandemic era. But I hear stringent COVID-19 prevention measures are in place at this year's film festival.
Yes, indeed. The Venice Film Festival is a big and well-known event in Italy. This year's edition is very different from what we remember of it. Many films are going to be broadcast remotely. The public largely won't be admitted in the festival premises. But still, we're looking forward to seeing some nice films be released and enjoy them.
Right, so are we, Irene. Now, just about a month ago, Irene, daily cases in Italy were down to about 200. In recent days, the number of infections has been hitting above 1,000 a day. What appears to be the reason for this resurgence?
There's numbers of reasons behind this. The country is mostly looking at people who are coming back from holidays, being increasingly positive. People moving around to other countries as well, traveling to other countries, have been a source of worry, and younger people as well attending clubs, which was a decision to reopen clubs that has been criticized in the first place.
Irene, in a bid to ease the economic fallout from COVID-19, authorities lifted their lockdown back in May. How effective has the lifting of the lockdown been thus far?
Italy has been adopting a number of measures. The economy has been hit hard by the pandemic, and it still is. The recovery is going to take extremely long. We lost about 12 points of GDP in the last quarter alone, which is worrying. Lots of businesses have shut down, and the government is trying to prevent people from losing their jobs, but it's indeed going to be a challenge, and these months ahead are going to look extremely worrying, especially if the cases continue rising.
I see. And if the cases do continue rising, Irene, what are the chances of a second national lockdown?
National authorities are trying to comfort people that everything is still under control and that the situation is still manageable. Yet, as you said, we are seeing a strict increase in cases, and we don't really know whether the moment that schools will open in about 2 weeks, whether that's going to make the situation worse and increase. People are going back to their regular lives, so it's going to be a challenge for sure.
Right. Irene, you just mentioned state schools being poised to open on the 14th of September, to be exact. What is the response to this reopening of the academic arena among the public?
We know that reopening schools has been a challenge in most countries in the world. Italy has tried to learn some lessons from that, but still there are some problems that are peculiar to the Italian situation, that is overcrowded classes, overcrowded classrooms, a general lack of resources, and old buildings, and so a number of issues that derive from underfunding, and that the government is now trying to fix, but still people are indeed worried. Families are worried of sending their kids back to school, and teachers as well.
Irene, you mentioned overcrowding in the classrooms. Will students in these classrooms be required to wear face masks during lessons?
There was a big talk about it over these last few days. The government has decided this far, but then it could still change, that students are going to be required to wear masks the whole time when they're not sitting at their desk. So for as long as they're in the classroom and sitting at their desk, they can be without one, but for any other occasion, they have to wear one, yes.
I see. Irene, Italian researchers have begun testing a potential COVID-19 vaccine on volunteers, I understand. Could you tell us more?
Excuse me, could you repeat the question, please?
I understand that testing has begun on volunteers for a potential COVID-19 vaccine by Italian researchers. Could you tell us a bit about that, Irene?
Yeah, sure. Italy, like many other countries, is trying to research and put the researchers at work on a vaccine. The first one has been developed by a company in the Rome area, and the very first trial happened on a human being, happened about a week ago in Rome at the Spallanzani Hospital, which is specialized in infectious diseases. this is very good news, and we are hoping that Italian research can contribute to a vaccine that can be of use to the world when it comes to managing the COVID-19 pandemic.
We'll also keep our fingers crossed. All right, Irene, thank you very much for being with us live at this hour with your thoughts.
Thank you. Thank you for having me. Goodbye.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular afternoon briefing on COVID-19. Now, while we wait for the briefing to start, here is perhaps a short look at the tougher social distancing measures that have been put into place in the Greater Seoul area until the 6th of September. Restaurants, bakeries, and even food trucks will have to close their on-site dining services by 9 in the evening. They can be open for takeout services from 9 in the evening to about 5 in the morning. This also applies to convenience stores that have sitting arrangements. Gyms as well as other indoor sports facilities will remain closed for the rest of the week, as will cram schools and other academic-related venues, including the so-called study cafes. Speaking of cafes, franchise coffee shops are allowed to offer takeout services only. Also, patrons to these franchise coffee shops will be asked to leave behind their personal information, including their numbers and name, of course, to allow for efficient contact tracing in the case of an outbreak. Now, this measure comes in response to a recent cluster infection at a coffee shop in the city of Paju earlier on. Meanwhile, to protect the elderly who are particularly vulnerable to COVID-19, authorities have asked family members and friends to refrain from visits and to opt for virtual calls if possible until the 6th of September. Public transportation will also be affected by the latest stringent measures, as nighttime bus operations have been reduced by about 20% after 9 in the evening in a bid to discourage late outdoor engagements. Also, banks here in the Greater Seoul area will be operating from 9:30 in the morning to about 3:30 in the afternoon, as opposed to 9 to 4 in the afternoon, that is. Now, we are still waiting for the briefing to commence, and perhaps we can take a look at today's figures for Korea on this Wednesday. We have 267 new infections, raising our number of confirmed cases to 20,449. We have 2 more fatalities, raising our death toll to 326. The number of those in quarantine has risen by about 100. And I hear the briefing is about to start, so we'll come back to you afterwards.
First of all, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 2nd, Wednesday, we have a total of 253 new local infections and 14 new imported cases. The total caseload now stands at 20,449. 158 more people have been discharged, while 75% have been discharged so far, and 4,767 people still remain in quarantine. We have 124 patients with severe or critical conditions. This is a jump by 20 from the day before. We had 2 additional fatalities, and the death toll now stands at 326. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the updates on our domestic infections by region. And related to Sarang Jail Church in Seongbuk-gu District, Seoul City, we have 34 additional cases being confirmed, and a total of 1,117 people have been confirmed to date. Of them, 558 people are worshippers, and 130 of them are also secondary infections, and 102 cases are under investigation. And looking at the age group, those under the age of 60 account for about 40% of the total, being more than 400 cases. And so far, in relation to the Sarang Jail Church, we have a total of 27 venues that have been found to have further transmissions from the church, and about 190 confirmed cases of further transmissions have been identified so far. And related to the August 15th Seoul rally, we have 22 additional cases being confirmed. In total, we have 441 people being confirmed to date. So far, in relation to the rally, we have identified that 10 venues have been further transmissions from the rallies, and a total of 116 confirmed cases of further transmissions have been confirmed. And here are some new cluster infections in Dongjakgu district. We also have an organization there where 9 additional cases have been confirmed, and a total of 10 people have been confirmed to date. And in Gwangjin-gu district, we have the Haemin Hospital. We had the first index case identified on the 31st of August, and we have 9 additional confirmed cases. And of them, 8 are the medical practitioners, and also 1 of the employees and family members respectively. And we believe that the risk factor is that they had a group dinner together. And in the Nowon-gu district, we have the Buniel Prayer Center, and we also had the first index case that was identified earlier. And we also identified that we have 7 additional cases, and so far 8 total cases have been reported so far. And in Seongbuk-gu district, we have a nursing hospital, and we have the first case of an index case who is a caregiver, and we have additional more contacts, and 7 people have been confirmed so far. And in Dobong-gu district, we have a fitness facility, and we have identified that SK table tennis, as well as in Dongdaemun area, and Jungnam-gu area, we also have another table tennis club, and we have been conducting the epidemiological investigations at these fitness facilities. And in the Sebi Church in Yongin City, Gyeonggi-do Province, we have 3 additional cases so far. We have 18 cases being confirmed to date. Among them, 11 are the worshippers of the church, and we also have 7 people who have visited a spa and at the Jeju-do Island. And in Incheon, we also have a prayer meeting, and we have identified 20 additional cases there, and a total of 21 cases have been confirmed to date. And in Daejeon City, we have the Daejeon Full Gospel Church, and we had the first index case being reported earlier last month. We have 13 additional cases being confirmed, and in total, we have 14 confirmed cases to date. Next, let us now look at the imported cases today. As of September 2nd, we have 14 imported cases, 3 of which have been confirmed at points of entry, while the rest of 11 have been reported on self-quarantine. 6 of them are foreigners. And as for the countries, we have 6 from Asia, and we have 7 from the US, America as well. And as for the patients with severe or critical conditions, as well as the fatality, we have some updates. We have a total of 326 is the death toll that we have, and among them, 97% had chronic illnesses, and we have noted that the fatality rate differs among the age group. However, those above the age of 80 was actually higher than 24%, and this continues to rise. And we have confirmed that 1 out of every 5 people in the over the age of 80s, they are also leading to a death. And also we have had 20 deaths over the course of 2 weeks, and we also identified they were dispersed in the diverse age group, and all of them were above the age of 60. And looking at the sources of infection out of the fatalities, we have identified that 9 were under investigation, and 4 were related to the Seongbuk-gu Sarangjeil Church. 2 were the contacts of confirmed cases, and others were also related to Gwanak-gu office and the Songpa-gu religious meeting, and also also Incheon Galilee Church as well. And these cases had one each of these fatality. And today we have 124 patients with severe or critical conditions. Those over the age of 80, we have 30%, and 52 people are over the age of 70, are in the age group of 70 as well. And also we have 7 people in the 40s and also 14 people in their 50s as well. And we have been seeing a higher number of proportion of the severe or critical conditions over the age of 70. However, we have an increased portion of these patients between the ages of 40 and 50. And looking at their sources of infection, 52 are under investigation, and also 20 of them were secondary contacts. And in relation to Sangbuk-gu Sarangjeil Church, there were 18, and also in relation to the Seoul rally, we have 8, and 5 were related to the Gold Train meeting in Seoul. Likewise, there is a very high risk of making into the patients with severe or critical conditions if you are senior citizens, and this is why you need to take particular precautions. And as COVID-19 is also spreading at a very fast pace, regardless of regions, please stay at home if you are senior citizens, and also if you have to step outside, please wear your face masks as well. And if you do not feel well, please get tested at a clinic as soon as possible. Moreover, as for the facilities that are frequented by these senior citizens, including all of the health clinics as well as nursing hospitals, we need to curb the infection spread there. And it is very important that we have take precautionary measures taken by all of the managers and health professionals there. And as for all of the staff members and health professionals, we would like to note that you should refrain from going to multi-use facilities, including singing rooms, PC rooms, cafes, and restaurants. Moreover, we have seen a large number of social gatherings that have been prone to infections, and we ask you to refrain from having meetings with people outside of your family. And moreover, if you have symptoms like fever or respiratory symptoms, please do not go to work and get tested as soon as possible so that we can cut the chains of transmissions into the spreading into these health clinics and nursing homes. Moreover, when you are at your duty, please wear your face masks at all times, and this would be very effective in curbing further outbreak. Moreover, COVID-19, even 2 to 3 days before it is showing symptoms, you also can spread the disease. And so there are a large proportion of people who have no symptoms at all. And please note and understand and remember the fact that you can spread the virus even though you are asymptomatic. So you should wear your face mask and wash your hands on a regular basis and take other precautionary measures as well. And as for the managers working at these facilities, please reduce the number of outside visitors, and please have good ventilation on a regular basis. And if there are any people within the facility that have symptoms, please get that person tested as soon as possible, and please take a good care of the facility going forward. Currently, we have the level 2 social distancing measures put in place, and we ask the members of the public to practice the public guidance for level 2 social distancing going forward. And if you have to go outside, and it is very important that you cancel all of your non-essential travels and social gatherings, and also wear your face masks even if you have to go outside. And please do not go to work or go to school and go outside if you feel sick, and get tested as soon as possible. And last week, we had a peak of on-day increase of 400, and we have seen a decline in the number of on-day cases thanks to our participation of the social distancing measures. However, we have daily cases of 250 on a daily basis. And last week, I have stated, citing a model, infectious disease model, that if the trend continues, we could have about 800 to about 2,000 cases on a daily basis. Of course, right now it is very fortunate that we are maintaining the increase at about 200s, and thanks to the participation from the public, we were able to contain the outbreak to a certain extent. The core essence of our K-quarantine that we have exerted so far for the past 8 months, I once again highlight that it was all due to the solidarity and unity by the public. And for the past 9 months or so, we have been experiencing the COVID-19 pandemic, and this has deprived many people's daily pleasures, as well as it has also brought many financial losses to many people as well. And I believe that there are a high level of fatigue on many people as well. And the medical practitioners also are going through a great level of fatigue and stress. And I understand such difficulties and challenges. Nevertheless, we have been seeing the secondary crisis here that started in August. And once again, I urge the public to participate in quarantine measures going forward. Please understand that solidarity, unity, and also consideration of others is something that we need to overcome the virus. So let us all muster our energy once again. We believe that the remaining of this week is a very critical moment to determine the future states of our secondary massive outbreak and how it will unfold in the near future. So we believe that it is a very critical moment. So let us continue to be vigilant and overcome the COVID-19 challenge. So we ask for your consideration and participation. We ask you multiple times, and however, in order to curb the virus, it is very important for you to wear your face mask, to protect yourself from the virus, and to minimize physical contact with others so that the COVID-19 virus cannot spread among people. And we ask you to stay home safe and sound, refrain from going outside, and also wear face masks at all times when you go outside, and keep 2 meters of distance and wash your hands on a regular basis. The quarantine authorities will also exert our full efforts to flatten the curve. Thank you very much.
Right, that was Chung Young, the head of KCDC, with Wednesday's afternoon briefing. So she appears to have gone into much detail about the fatality rate.
Exactly, and that because the fatality rate is really high when it comes to elderly people. In fact, people aged 80 or above, the death rate is at 20%. And currently, out of the 124 patients that are in severe or critical condition, 30% are in their 80s. So if you do the math, 1 out of 5 people in that age group die. And also in the past 2 weeks, there were 20 fatalities, with a majority of those related to religions. In fact, 4 of those were linked to the Sarangjeel Church in the northern Seoul, and more than a quarter of people linked to that case have not let themselves tested as of yet. So that is a big concern.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Meanwhile, Korea is bracing for the 9th tropical storm of the season, Maisak. It is forecast to be stronger than Typhoon Bavi, which carved a path along the country's west coast last week. For more, I have Professor Choi Young-jun from Hallym University live on the line. Hello, Professor Choi.
Hi, thank you for having me.
Professor, Typhoon Maisak is expected to keep people indoors, raising the risk of COVID-19 infection within confined and crowded places. Do you share these concerns?
Basically, the virus is primarily spreading from person to person through the respiratory droplets that are released in the air when we are talking, coughing, or sneezing. So when you are in the indoors, we are more likely to inhale these droplets from the infected person. So especially if you are in close contact, it's because we are sharing more air than we do in outdoors. So by the risk, the poor building ventilation can cause the droplets to hang around in the air for a longer period of time. That would add to the potential for the infections.
Professor Choi, last week we were fortunate enough to speak with a professor at the University of Sydney who conducted a study showing that high levels of humidity may hinder the spread of COVID-19. Now, heavy rain will lead to levels of humidity in the air going up. Do you see this weather condition affecting the latest spread of the virus here in Korea?
So in general, the dry air is known to facilitate the transmission of many respiratory viruses. But from the evidence so far, the COVID-19 virus can be transmitted in all areas. And basically, there are certain environmental factors like climate change and the humidity and the temperature that explains the spread of the virus. But basically, all areas, including areas with the hot and humid weather, that still does facilitate transmission. So my thought is that regardless of the climate, we should adopt the protective measures if we are living in or traveling to places that are reported to have the COVID, like here in Korea. So the best way to protect ourselves is by frequently cleansing our hands and other hygiene measures.
And Professor Che, speaking of those measures, could you walk us through the safety measures to be practiced indoors amid the rain outdoors?
So basically, we think the face mask could slow down the spread of the COVID virus, combined with other preventive measures such as frequent hand washing, physical distancing with others, which will definitely slow the spread of the viruses indoors.
Professor Che, quite a number of people displaced by the monsoon are currently seeking refuge at temporary shelters. What measures are of utmost importance at these makeshift shelters amid the pandemic?
So the shelter services are often provided in very congregated settings, which will also facilitate the spread of the infection. And because many people who are in the shelters because of the flooding might be older adults or might have the underlying medical conditions, so they may also be at an increased risk for the severe illnesses. So I think from the public should be aware that the people who are in the shelters are particularly vulnerable group. So if possible, identifying some non-congregate settings where those are who are at a higher risk can stay might help to protect them from the COVID-19.
Before you go, Professor Che, do share with us some final words of caution as we seek to endure this latest outbreak of COVID-19 here in the country.
So I think as the COVID-19 pandemic continues, I think it is important to take care of ourselves and those around ourselves. Of course, practicing the good hand hygiene, like washing our hands, not touching our face with unwashed hands, and keeping the physical distancing from others, wearing masks all the time. These are all good steps to take. Especially these steps are important for those with a higher risk of serious illnesses from COVID-19 that was previously just been reported about a minute ago.
All right, Professor Che, thank you very much for making the time to share your thoughts with us at this hour.
Thank you.
혈장 치료제와 관련해서는 총 1,696명이 완치자께서 참여 의사를 밝혀주셨고 실제로 혈장 공유가 완료된 규모는 1,274명입니다.
Only a few of them have actually reported out on results, and the results are not conclusive.
In today's studio session, we explore the efforts being made to better tackle COVID-19, including ways to prevent it, as well as ways to treat it. I have Dr. Kim Seung-taek from Institute Pasteur Korea here in the studio. Welcome, Dr. Kim.
Okay, thank you for having me.
And joining us live via Skype is Professor Justin Fendos from Tongso University in Busan. Hello, Professor Fendos.
Thank you for having me.
Right, you are with us via Skype as we seek to abide by government calls for less travel between cities as part of efforts to contain the latest outbreak.
That's correct, yeah.
Right, first then, Dr. Kim, among the known drugs to treat COVID-19 currently are remdesivir, an anti-Ebola drug, and dexamethasone, a steroid, I believe. Yes, and of much interest here in the country is convalescent plasma therapy. Now, in layman's terms, Dr. Kim, could you explain to us what this therapy is?
Well, the blood is actually composed of some blood cells and some sort of just liquid. So if we just separate those the blood cells into with from the liquid, those liquid is actually we call plasma. Those plasma contains many, well, in this case, the antibodies and other just some immune-related the proteins. But what is interesting in this case is from the patient who recovered from the COVID-19, we are actually expecting some neutralizing antibody from those the patient's blood. And then actually the key player in those the plasma is actually the neutralizing antibody. So in the plasma therapy, basically just a key player is a neutralizing antibody. So we are actually using those neutralizing antibody to treat the patients with the COVID-19. So the main just mechanism of action of those neutralizing antibody is basically blocking the interaction between the viruses and the cells. So it's a very early stage of the virus replication. So this plasma therapy is well pretty. I mean, this has a pretty just a long history. I mean, has actually just started about just 100 years ago, and then recently it was also used in the MERS outbreak and the Ebola outbreak. And then the plasma therapy is sometimes considered as the some last resort when there is no, I mean, therapeutic just options available. So, but this is, well, there's some concern, but it has been used quite a while.
I see. Dr. Kim, I understand there's also a difference between convalescent plasma and hyperimmunoglobulin, which is what researchers here are using to develop possible drugs against COVID-19.
Right. So basically, this, the key player is the same. The neutralizing antibody, this is the same. But the main difference is that when you just say the plasma therapy, well, from the recovered patient, we collect plasma, and then somehow we just administer the plasma into the patients sort of just directly by transfusion. But for some sort of just plasma-derived plasma-derived medicine, when we just call, as you say, just a hyperimmunoglobulin. This is in this case, after collecting the plasma, there is some sort of just additional the process. For example, like some purification steps and also some concentration steps. So this can be just used as some sort of just a drug. So also one of the differences in the plasma therapy, the plasma from each recovered patient, actually level of just the plasma, the neutralizing antibody concentration is different. So then in some plasma-derived sort of just medicine, well, I don't know all the details, but some company has tried to somehow just standardize those kind of the neutralizing antibody, because some patient has a very low level of neutralizing antibody, some patients has a higher level of neutralizing antibody. So we need some sort of just a standardization.
I see. Now, Professor Fendos, over in the US, there has been heated debate following the FDA's issuing of an emergency authorization last week for doctors to treat COVID-19 using blood plasma from patients who have recovered. Now, in a more recent response, the National Institutes of Health panel has claimed there is no proof to back the use of convalescent plasma to treat COVID-19. Please tell us more about this debate.
Right. So the thing about convalescent plasma and plasma-based therapies is that in theory it should work. So I think Professor Kim gave a very good explanation of how it works. And the main player is in fact the antibodies. I would also like to add that there are other proteins involved that might be helpful. So for instance, we have some new evidence now that another class of proteins called interferons might actually help you as well. But the main issue at this point is there hasn't been a really big, large-scale study to really verify that, yes, when you give people, this plasma-based therapy, that you actually get good outcomes. And as Dr. Kim was mentioning, there's also an issue about, how exactly are you going to go about collecting, processing, and storing the plasma? Because presumably, certain ways of doing it are going to be better than others. And so we don't have a unified strategy for that. But there are also two other concerns that often come up. The first has to do with variability. So for instance, if you and I make plasma donations and our plasma is given to the same patient, chances are the outcomes for that same patient are going to be different, because you and I, even though we got sick and we made these antibodies, the quality of those antibodies could be different. The amount that we have could also be different. And so these kinds of variables are difficult to work through, because unless you have a really robust procedure for seeing what you have, you really don't have a good handle on these things. And then the third issue that also comes up a lot has to do with side effects. So as Dr. Kim was mentioning, convalescent plasma has been used quite a bit for other purposes, especially for disease prevention, but also for helping patients clot their blood. So these are people who, for whatever reason, have difficulty after they get a cut in stopping the flow of blood out of the body. And so plasma-based therapies have been used for this. The problem is, for coronavirus, we know that one of the severe symptoms is clotting of the lung tissue. And so it still remains an open question whether or not, if you give them this plasma, whether that symptom will be made worse or not. So there are a lot of unanswered questions yet left that probably need to be worked through, but in theory, it should work.
Right. Now, the US FDA's approval reportedly follows preliminary findings by the Mayo Clinic that shows convalescent plasma therapy reduces mortality. Now, granted, the study itself has yet to be peer-reviewed, but we were lucky enough to speak with the lead researcher, Dr. Michael Joyner. Do take a listen.
I think we've clearly addressed the safety problem, and people have to remember that this is a variation of something called fresh frozen plasma, or just simple plasma, which is given all the time. And while there are some safety concerns with them, they are not huge in comparison to the problems hospitalized patients have with COVID-19. Early therapy with high quality plasma is essential. And in the United States, there are ongoing trials for people with mild disease and for people who've just simply been exposed to COVID-19 for prophylactic purposes. So I think there could be a major success story there. We will see. I think in terms of ending the pandemic, the key things to ending the pandemic are standard public health measures, which, for example, you've been so good at in Korea. Convalescent plasma, something called hyperimmune globulin, monoclonal antibodies are potential therapies for treatment, but these really are only can only take a small bite out of the overall problem compared to public health measures and a vaccine.
Right, Dr. Kim, just as Dr. Joyner just mentioned, I suppose in any debate about a potential treatment to a certain illness is the issue of safety. What are your thoughts on this?
Well, actually, as Dr. Fandos indicated, my major concern is that the clotting factor. Actually, I don't know all the detailed number, but as far as I know, but number of people actually just suffering from the clotting, blood clotting among the patients with COVID-19. But generally just the plasma contains the blood clotting factor. So if we somehow just administer with the neutralizing antibody, also with some blood clotting factor, it might just exacerbate the symptoms. That's I think it's the most the serious concern, other than the well-known just allergic reaction and so on.
I see. Professor Fandos, when is a new drug for a particular disease considered safe for standard use on patients?
Well, so usually the safety standard is determined by law. I mean, I think if you ask the average person whether or not the standard by law is what they would consider safe, I think you would get different answers. So if you're looking at most of the treatments and most of the vaccines that are being tested right now, all of the good ones, I would say, are going up to phase 3 clinical trials, which means that you have a fairly large population of people that are being tested, and the health aspects, the side effect aspects have already been tested in previous phases of the trial. Now, one of the things that is missing, though, that a lot of people don't talk about is the long-term consequence of that treatment. So, for instance, and this is usually called phase 4, ideally what you like to see is 6 months from now, a year from now, or 3 years from now, does this treatment or does this therapy cause trouble? But we're kind of in that situation where we have to balance the tightrope. We want this thing quickly, and so we probably can't wait those 3 or 5 years to really see long term whether or not you get bad side effects or not. So there is some give and take here in terms of the risk and the safety, as well as the usefulness of the things that are being developed.
I see. Dr. Kim, here in Korea, how far have we come in efforts to develop plasma-derived drugs based on immunoglobulin, that is?
Well, actually, we have actually just trying to develop the drug in 3 different ways. One is the plasma therapy, and the second one is a monoclonal antibody. This is very close to the plasma therapy, and the third is drug repositioning, just approach. But then for the plasma therapy is by far the first one, and the Korean government actually anticipating this one would be the firstly probably available the therapeutic options for the patients, and then. As you said, we are on the clinical trial, the phase 2, so we are still waiting for the outcome.
Right.
Yeah.
Professor Fenders, you mentioned this earlier, but with regard to plasma therapy, the most important thing perhaps is the ability to get the plasma from recovered patients, to process it and then to store it. How or what ways are there of us trying to come up with a universal way to do this, do you think?
Well, so the collection is, I mean, you stick a needle in someone and you collect it. I think that the spots where we're going to have more debate are how you're going to process it. So in theory, like Professor Kim was suggesting earlier, in theory, if you spent enough time and enough resources, you could purify out the antibodies that you want from plasma. But most hospitals can't do that, so there would have to be some kind of pharmaceutical company or somebody to step in to handle that process for you, which means that, you know, the price of the treatment would go up. But generally speaking, the processing aspect and perhaps the storage will be one of the spots where we need more work. But then also another thing that a lot of people aren't talking about yet has to do with matching. So for instance, if the patient that you want to treat is, let's say, African American, but the donor is white, how will that affect the outcome? Some of these things we don't have a good handle on yet, and perhaps gender might also have an effect. And as Dr. Joyner from the Mayo Clinic was saying, because of the clotting issues, ideally you would like to have a whole lot of plasma and you'd like to use it early if you could. But when the supply becomes very limited, chances are you're going to try to give it to the most severe patients because they're most likely to die. And so there's also that kind of give and take there too about how you're going to balance the risk with the potential outcome.
I see. All right, Dr. Fenders, as always, thank you for your thoughts and thank you for joining us all the way in Busan, from Busan that is. And Dr. Kim, thank you for being with us today.
Thank you.
Right, and on that note, we end Wednesday's edition of COVID-19. Do join us again tomorrow as we address both the physical and psychological toll of the pandemic on the public. In the meantime, for those of you here in this part of the world, do stay safe from the typhoon as well. Thank you for watching.